Mahamat was just 9 months old when he got violently ill. For 3 days, he suffered a severe fever before his family took him to a nearby clinic in northern Cameroon. However, treatments were limited to antibiotics and a wet towel to lower his body temperature.
His temperature was 39.2. We made a wet package for the child to lower the fever before administering the antibiotics. Artesunate has been out of stock since February, so we referred the child to the district hospital for further care.
Artesunate is a popular anti-malarial drug and may have saved little Mahamat, but he died that evening. Sitting outside his home, Mahamat's father, a sorghum and banana farmer, is still distraught. His wife, Fatima Mado, seated next to him, the same.
After the burial of the child, from that day until today, I don't feel comfortable. Even going to work at the farm, my body does not have the energy to work.
What makes it even more tragic for his parents is that his death was entirely preventable. Up until a few months ago, the clinic would have had the drugs to save Mahamat's life, but global funding cuts, his father believes, were his death sentence. And experts say, unfortunately, it's not an isolated incident.
The consequences of the stop in malaria funding for children in the community is that we are going to record deaths due to severe malaria. Severe malaria, when not well treated, causes anemia. When anemia settles in, death follows. This year, from January to August, we have registered many cases of death in the community.
The U.S. funding included not just treatments for malaria, but also preventative efforts. Hundreds of community health care workers would travel to remote villages, distributing bed nets and identifying serious cases, but their work is now out of service. Some anti-malarial drugs are trickling in, but it's nowhere near enough, and that's likely to have deadly consequences.
The need in terms of the region are around 350,000 amipoles. This means that we'll only be able to cover a part of the fourth quarter, which is already being prepared. This comes at a time when it's the peak of malaria.
Cameroon is expecting a peak of malaria cases this month, but with malarial medicine in short supply, health officials fear the worst. As for the longer term, they hope all the gains they've made against the disease in the past won't be for nothing in the future. Caroline B., CGTN.